Both professionals have been accused of misleading the general public regarding recent tetanus and polio vaccination programs, and in doing so are said to have stepped outside their fields of specialization. The doctors in question have also been accused of misleading the general public through social media, and several of their posts were included as part of the complaint. On May 23rd, Dr. Stephen Kimotho Karanja wrote a Facebook message that questioned why many children developed fevers, vomiting, diarrhea, headaches, convulsions, and red eyes following the administration of the polio vaccine. Dr. Wahome and Ngare's post said that they had provided scientific evidence to prove their case about the tetanus vaccine as asked, but the results were disputed even by their own. All these started in October 2014 when reports from the Kenyan Catholic Doctors Association stated that 2 to 3 million girls and women of childbearing age in Kenya had been vaccinated with tetanus vaccinations containing the anti-fertility hormone HCG, rendering them infertile. The Catholic Church called for a boycott of the tetanus and polio mass vaccination exercise, prompting the Pharmacy and Poisons Board to ask a Greek Quest, a laboratory, to do further tests on the tetanus vaccine. According to the laboratory report, the vials tested were found to be contaminated, and the government has been accused of attempting to cover up the anomaly by asking a Greek Quest Limited to alter the results to show that they were safe to be administered, but the laboratory declined.
We cannot go on and support this vaccinations campaign. Why? Because insofar as we do not have clean results to assure Kenyans that what they are receiving, they are clean, then we are not, as the Catholic Church, and we ask also the Kenyans, we are not going to support.
Early last year, at the direction of the bishops, the vials were tested at 5 different laboratories in Kenya. The government rejected the results, citing poor methodology. The Ministry of Health said it tested 10 vials and found them to be free of the hormone. Preliminary test results released in January 2015 showed that 3 of the 9 vials of the tetanus vaccine contained beta HCG, a birth control hormone. The others tested negative. On 4th of this month, the Kenyan Medical Association told Kenyans that the tetanus vaccine currently being administered.
Allegations that some of these vaccines are laced with contraceptives or other harmful substances are therefore baseless, and where any evidence has been adduced to prove them, this evidence has been shown to have been dismissed after rigorous research over a long period of time.
Though their appearance before the board was closed door, it is said that an agreement has been reached to look further into the concerns of the 2 doctors about the vaccines before any decision is made. Mercy Juma Okande, NTV.